I'm Ashley, one of the nurse practitioners at Ponte Vedra Plastic Surgery. I do everything at Ponte Vedra: injectables, filler, Botox, laser. We have PRP, but today we were going to talk about ThermiVa. It's one of those subjects that people definitely don't always like to talk about, but it's an awesome procedure that we have, and we have it on special for our luau, so I'm going to just chat about it real quick. ThermiVa is a technology that it actually has many counterparts that the doctors can do certain things for facial tightness. The estheticians also have a modality, but the nurse practitioners, we are able to do ThermiVa, which uses radio frequency technology to help stimulate and rebuild collagen. Heating up that tissue stimulates the collagen, and it naturally starts to generate more because, of course, as most people know, as we age, we lose collagen. So that's why we have a less youthful appearance and things just don't seem the same. Just between that, if you've had babies, menopause, I've had 2 children myself, and things change, unfortunately. And it can lead to lots of different things. Laxity is a big thing. Stress incontinence, a lot of people complain about that, among other things. And ThermiVa definitely can help all of those things. Let's see, candidates. Who's a candidate? Mostly everybody. There are certain people that cannot have it. Obviously, pregnancy, that's a no-go. You can have an IUD. Copper IUDs are not, we cannot do it with those, but if you have a Mirena or things like that, it's absolutely fine. Defibrillators, if you have that, you cannot get it. Obviously any infections, things like that, we want to avoid. And we do like you to, meet with your GYN prior and have a up-to-date pap smear and make sure everything is normal. So really, besides that smaller population, anybody can get ThermiVa. Let's see, treatments. So it is a series of 3 treatments. We typically like to do it 4 weeks apart, and the procedure is about 30 minutes long. Is 30 minutes long. Typically, you can treat internally and externally. Internally is what you get the best result with. So we typically treat 20 minutes internally, and that's going to help with the tightening, with the urinary incontinence. Through menopause, people have issues with dryness, things like that. It helps with all of those things, sensitivity. Externally, it does help externally, but I will tell you that the results do not last the way that they do internally. If your goal is externally, you have to do many treatments and you have to keep it up often. So typically we do 20 minutes internally, 10 minutes externally. But after your 3 treatments, which, like I said, 4 weeks apart, typically it lasts a year, if not more. I've been doing ThermiVa for a couple years now, and I will say that I have people coming back about a year or so later, and we're doing one treatment, one kind of maintenance treatment, and things are still good after that. But everybody's going to vary. We can't guarantee that it's going to last, a year and a half or however long. But what I've seen, it's definitely been a year. Afterwards, you can do whatever. There's no limitations. You can exercise 10 minutes after. You can have sex if you really feel like it. It doesn't matter. You can do whatever you want. And pain-wise, you don't have it. I mean, the heat of it is you may feel a little hot patch here and there, but it's extremely tolerable. I've never had anybody not tolerate it. And honestly, out of every patient I've treated, I've maybe had one unhappy patient, and I've seen a lot. And in our industry where we do so many different things, you try to make people happy, but I will tell you this treatment, the satisfaction rate is probably the highest. Let's see if I missed anything. And if you have any questions, feel free to type them in and let me know. Let's see if I've missed any of the pertinent stuff. Okay, so one of the questions, how long after treatment does it take to feel the results? So it varies. Some people, I'll tell you, after their first treatment, feel like there is a difference. But if I have somebody come back and be like, I didn't notice anything after the first treatment, I don't panic, because honestly, after 2, they always come back and say, okay, now I see a difference. But I do have a very good amount that do notice the difference after the first. They say, you know, things feel tighter, or I'm not peeing on myself like I was when I was jumping around with my kids. So it definitely, some people see it after the first, but I don't panic if they don't, because after the second, they definitely are seeing results. And then let's see. So I have a question about cost. So it's a series of 3. So right now through during the luau, we are doing, typically it's 3 treatments for $3,000. And right now it is 3 treatments for $2,700. That, you know, maintenance treatment, I typically do it for $800. But the initial 3 treatments right now for the luau special, it's 3 for $2,700. And honestly, consultation wise, if you have any of the symptoms that I said, which if you've had children or just age in general, you probably do. Like I said, most people are candidates and they're gonna see a result. I've had just amazing results with ThermiVa. Let's see. Any other questions? One second. And also with the consultations, there's no charge for a consultation, and we can absolutely do same day treatment with consultation. What I would tell you is when you call and make your appointment, let them know that you want to talk to me and that you were on here with me, and they just need to allot the appropriate amount of time. I at least, like I said, the treatment takes 30 minutes, like a standard 30 minutes, and I need a good 15, plus minutes, chat with you and let you, get changed and set everything up. So we definitely want to make sure we have a good 45 minutes to an hour for the appointment. Although the procedure, like I said, takes 30 minutes, but we like to allot ourselves a little extra time. So you can definitely make an appointment, same day consultation and treatment. And also, if anybody has any questions, PRP, yes. So PRP is another one of our specials that we have going on. It is, so if you purchase the 3 treatments, which PRP, we like to do the 3 treatments, and I'll go more into that. Then you also get the vitamins that we recommend and the shampoo and conditioner. So PRP helps with hair loss. We dry your blood, we spin it, and then we take out the good gold stuff and we inject it directly into the scalp. I've seen really great results, male and female. And people have been really, really happy. So typically what we do is this is another, treatments where you have to do multiple treatments For PRP, we do 3 treatments, and we do them 4 weeks apart. And then we do a 4th treatment 6 months out. So that really gives us the time to allow that hair growth cycle, because it takes a while for the hair to grow. With the injections, we like you to do supplements. We recommend Nutrafol. Nutrafol, there's a male and female supplement, and it helps. It hits different modalities, and I know there's certain ingredients that also help with stress and things like that, which is always a good thing. And it has a lot of great vitamins and minerals in it. And we definitely like you to take that throughout the treatment process, if not afterwards. It's really, you want to hit every level of it. We also have a shampoo and conditioner that has more vitamins than, say, your over-the-counter shampoo and conditioner. There's also, you've heard of Rogaine, or it has an ingredient called minoxidil in it. That's another modality you could add on to it as well, in addition to biotin. We really like to have you hit all those different things, as well as the PRP injections, to really have to maximize your results. Every patient's going to vary person to person. 20% increase, we're happy with that. And I know a lot of people are like 20%, but if you're having hair loss, 20% is pretty significant. The goal is, it helps with, the thickness, helps increase the growth, and it really makes a difference. But we're seeing really nice results with this. Originally, we were just doing the 3 treatments, but through we've read different things and gone to different conferences, and we've learned that doing that additional 6-month treatment is really what's best, to add that little extra punch to what you've already done. I can't tell you that it's pain-free like ThermiVa, but we do, we have a couple options. You can do a local block, which we haven't been doing as much because it can leave you with a little bruising, things like that. So we do have, we have our laughing gas, essentially, and that helps kind of take the edge away of the injections. You still can feel it some, but it's very tolerable, and really what the laughing gas does, it just takes the edge off of it. It's like having some glasses of wine where you just don't care as much, and a lot of the patients think it's really fun and enjoy it. So that's typically what we're doing while we're doing the injections, and it's really quick. By the time we spin it and have to inject it, we have to inject it within, I believe it's 8 to 10 minutes. So it's pretty quick how fast we go on the scalp. Any questions about the PRP? And if you go on our website, we do have some before and afters. And if you do come in for a consult with me, I have some as well, but we can definitely get them on the website. But I will tell you, male, female, I've had really nice results. Hormonal issues, if you have a really bad thyroid issue, it does not work as well because I can't control your thyroid. But it definitely, if you're kind of regulated with your thyroid, it definitely makes a difference. And I have after treatment, can you work out? Yeah, you can do whatever you'd like after treatment. Some people say they have a little bit of a headache because obviously I've injected their scalp. There's lots of injections, but they still go about their normal business. You can, typically I have you shower, like wash your hair the following day. You can rinse it, but don't want you scrubbing it. But you can work out, go back to work if you want. Your hair looks like a mess when you leave, but if you work from home, it's totally fine, but you'll feel fine to do whatever you'd like afterwards. Thank you for coming, Molly. Trust me, we can't wait to be open either. We're ready for it.